Hello, everyone. This is Dr. Mike Chu, a physical therapist. Hey, today we have, of course, she's not a special guest. She's like a mainstay. Today we're going to be talking about World Alzheimer's Month with our special neurologist guest and friend, Dr. Dona Kim. We'll be back in a few seconds, okay? Hey, Doc, what is going on with you there? How's everything you're back in Houston?
I am.
Well, what's been going on? How's life?
It's pretty good. Just got back from Seoul, South Korea.
I know,
Was
right?
there with
So
family.
I know we already talked about it. How long was the trip? So
We were there for 10 days.
10 days. Visited
hmm
family and everything.
Exactly. Yes.
Wow, wow,
Extended
wow.
family, my aunts who are in their 80s now. Yeah.
You don't have to answer, but did you grew up there? Or you grew up here in the States?
I grew up here. My
Okay.
first language was Korean,
hmm
but as soon as I started elementary school, my parents stopped speaking Korean in the home as much, to us anyway.
But do you still understand Korean?
I do. I really was worried about my ability to get around there, but I actually remember quite a bit. So that was encouraging and
That's
helpful.
good. That's good. Well, I grew up in the Philippines, so of course, the K-pop movement. There's so much K-pop, Korean pop culture now in the Philippines that everybody wants to be a Korean actor or actress or a singer or a dancer. So yeah. Um, anyway, on that same note, since you came from Korea, I'm from the Philippines, and you're back here. We're back here in the United States. We're going to be talking about World Alzheimer's Month. This is the perfect time for you to explain to us, what is World Alzheimer's Month, and how can we spread this knowledge and awareness to the people.
Yeah, so September is World Alzheimer's Month. The next couple of months as well are months to bring visibility to Lewy body dementia, to Alzheimer's again, I think, in November. Um, that may be particular to the United States. I don't remember which one that is, but we have several months in a row here where I think we have an opportunity to bring some more light to this disease that impacts so many people across the globe. I think the estimate right now is around 55 million globally, and that is to almost triple actually in number over the next 25 years. The majority of dementia is Alzheimer's type dementia. I think we've discussed that before. It's about 60 to 80% of all dementias. And so it's particularly important, I think, to bring awareness to that type of dementia in particular. And that's what we're doing this month is talking about Alzheimer's disease, Alzheimer's dementia, educating people, getting people connected to support who have a new diagnosis. Yeah, I think a lot of this is actually about education, because if we can identify these symptoms early as being distinct from normal age-related cognitive changes, um, and that's not an easy task, but if we can help people to do that in their own lives with their loved ones, then we can really accelerate diagnoses, formal diagnoses, and get people on the right track with the things that we can do to slow down the progression of the disease, and also to plan in advance to drive down the costs, the health and the social and the financial costs of the disease for families.
That's so true. That's so true. Thank you for pointing that out. You also mentioned the Lewy body, and yes, we're talking about Alzheimer's right now. And I just would like to remind everyone that we're always talking about dementia, dementia, dementia. Dementia is like the
Mhm.
umbrella term, and the most common type of dementia is obviously Alzheimer's, and that's what we're trying to bring awareness right now. That this month is really the World Alzheimer's Month, aside from being the physical therapy month. So every month has a there's always a celebration,
Mhm.
right? But today we're specifically talking about the World Alzheimer's Month for the rest of the world, that we need more awareness and
Mhm.
education, because people could be aware about it. But if we are not educated enough to properly diagnose, to properly take care of these clients, and we won't be able to take care of the loved ones that we have right now. So, Dr. Dawn, could you tell us again? You mentioned Lewy body, but let's go back to Alzheimer's. Tell us in general, what is Alzheimer's again?
Sure. So Alzheimer's disease is a neurodegenerative disease. That just means that there are brain cells that are lost over time. Usually, this is a pretty long period of time. It's not a period of hours, days, or weeks, or even months. It's more like years. Over that period of time, typically this starts to happen, when people are getting up in age, right? But the older I get, the younger 50, 60, 70 sounds to me. But we want to start thinking about these things, I think, in our 50s, certainly in our 60s, when we start noticing that we or our loved ones are
Why are
having
you
a
looking at me
change.
when you said 50s? That's just kidding.
Any change in memory or thinking, speech, behavior, personality, we want to make sure that we are vigilant. These things could be explained by many other things in our lives, right? That we're not getting enough sleep, that we are stressed out by work, that we have an infection going on, that we have a hormonal imbalance or an electrolyte abnormality in our blood. There are a number of other explanations, and so we want to vitamin deficiencies also. We want to make sure that it's none of those things, because those things can be reversed. Because a diagnosis of dementia ultimately is one that it has no cure. We only have things that we can do, interventions that will slow down the progression of the disease, nothing to stop or reverse it. And so you don't want to land on that diagnosis for someone without being absolutely sure that there isn't something that is treatable, that is the cause of the symptoms that people are experiencing. But yeah, Alzheimer's is kind of classically distinct from the other dementias, in that it really starts with this short-term memory loss as kind of the predominant thing that people experience. But we're finding that there are a lot of other symptoms that people can exhibit early as well. So that could be some of these other things, like I said, changes in kind of judgment, perceptual disturbances. So maybe you're not able to judge distances very well. You're getting into maybe some minor car accidents. These kinds of things can also happen in Alzheimer's disease pretty early. And so, yes, when these things happen, you want to be cautious and report this to your doctor. I did want to talk this time a bit about cultural fluency and why it might be a challenge to actually get a formal diagnosis, to get the appropriate counsel and care that you seek, that really you require for your family in particular. But yeah, I guess I'll stop there. As far as the definition of kind of what Alzheimer's is, I don't tend to go into a lot of detail as to what it is, like pathologically. But we do think it's an abnormality of proteins. For a long time, I think scientists thought that this was toxic clumping of proteins. More and more, we're finding evidence that it is maybe a loss of normal function of proteins, rather than the toxic accumulation of proteins. And that matters only because of how we're thinking about addressing this disease through drug therapies, because the drug therapies, a lot of the newer ones, really are trying to address this toxic clumping. And if that is actually not the fundamental problem, then maybe we are being led astray. So yeah, these are some of the facts. I hope will help to orient people as to what this is.
So true, so true. Thank you very much again for pointing it out, Dr. Dawn. So she mentioned also earlier about the reversible ones. So there's a lot of people there, I'm not saying quack doctors, but some people who will say, oh, it's reversible. No, it's not. If it's a true Alzheimer's, true dementia, it is irreversible, ladies and gentlemen. But if there's like the reversible ones, the thyroid dysfunction, she mentioned vitamin B12, hearing loss, so those are reversible ones, but they are not true Alzheimer's or dementia. A true Alzheimer's dementia is obviously the shrinking of the brain. She mentioned about those plaques or those proteins. So you got to go back, right diagnosis, early diagnosis. That way you can address it as much as early as possible. She also mentioned, ladies and gentlemen, cultural, I forgot why. I'm running out of English here, Dr. Don. Cultural competency when it comes to diagnosing. It's very important. In our culture, there's not a lot of awareness in the Philippines. People
Mm-hmm.
think and thought, or up until now, they think that Alzheimer's or dementia are just crazy people. And I remember when my grandmother was like, she can stand up at nighttime, but in the morning she's like paralyzed. She would don't
Mm-hmm.
want to go to the bathroom. My mom and my dad really thought that she was just crazy. But now that I'm educated and aware about it, I'm like, oh gosh, yeah, she had Alzheimer's, she had dementia. And every culture is different. Middle Eastern culture will be different. Uh, Southeast Asian people will be different. I mean,
Mm-hmm.
of course, American culture will be different. So go to an appropriate one that will help you and teach you and guide you. That way, you're not just like, okay, I'm not going to do this. I'm not going to tell anyone about my situation. And I'm like, okay. And then now you're stressed out as a caregiver. Anything else that you can add there, Dr. Donna?
Yeah, I think that there is a lot of stigma culturally, and that's actually across many different kinds of cultures. As you mentioned, there are many cultures where people have this belief that dementia is just people getting old who are crazy. Um, uh, Using that word actually in many different translations across different languages, right?
Mm-hmm.
And it's the troubling thing about that characterization is that it suggests that there is nothing to be done about it. And it's also very stigmatizing for the person who is living that, right? And that doesn't serve anyone. It doesn't serve the person who is suffering from the illness, and it doesn't serve the people who are trying to support that person or to care for that person, which is invariably what it takes in this disease, because it is a disease that ultimately results in the dependence, complete dependence, total dependence of a person on the people around them, namely their families. They may be chosen families, but the people around them, their communities, right? And so it is really important to think about how we may be maybe mischaracterizing this, right, as something that we can't do anything about. When the reality is that we know that in dementia, there are many things that we actually
Mm-hmm.
can do to slow down the progression of this disease. And for those of us who have increased heritable risk, right, or increased acquired risk, um, whether that is because we have many people in our family who are impacted by Alzheimer's disease, or we have, any of the risk factors like high blood pressure, diabetes, all of these things, right? I constantly refer to these 14 risk factors that the Lancet recently shared, like about a month or two ago. And that's good to refer to because it gives you kind of the breadth of the things that we can do to take action on our own risk. Those things, like if you say that this disease is something that is just what is it like? If you say that it is part of somebody being crazy, then then you don't actually create the space for us to intervene, for anyone to intervene, and that is problematic, right, for all of those involved. Yeah, I mean, otherwise, I would say. Other aspects of cultural fluency that really impact dementia diagnosis, counsel, and care are the lack of language access, right? Like in my own family, that has created barriers to actually getting a diagnosis and also actually continuing counsel on the matter, because there aren't a lot of people who are trained and specialized in dementia who also can speak Korean, right? Who are also bicultural. So for my parents and for me, trying to find that person for my father was a challenge. I actually don't know what my aunt and my mother did for my grandmother, or my aunts and uncles and my mother did for my grandfather and my grandmother. Currently, I have so much of this disease in my family. But I do know that we have one Korean neurologist who treats dementia in town who can speak Korean relatively well. And that's a huge barrier, I think, to diagnosis, because people are not comfortable, and I think appropriately so. They have concerns, right, that they're not going to get necessarily the right diagnosis. They're not going to get the appropriate compassion, I think, in communicating that diagnosis and working with the family if that person doesn't share their culture and their language.
It's so true, so true. Thank you for pointing that out too. So let's go ahead and highlight those risk factors that you were mentioning just on top of my head, right? It could be your medical history, ladies and gentlemen. It could be your hypertension. It could be your blood sugar, your diabetes, your social, your environment. In the Philippines, there's a lot of people socializing, so they're always out and about, talking to each other, singing karaoke. So they're just happy. But if you're always isolated, the risk factor of depression and dementia and delirium increases. So it's very important that you have that social factor too. Of course, your body weight, your body composition, it's a big factor too. So just all those risk factor comes into play. What else do you think are the other risk factors, Dr. Donna?
Yeah, some of those 14 risk factors include what you mentioned. They're kind of the cardiometabolic risk factors.
Were you looking at
So
me when you said cardiometabolic? So
I'm
I
not.
kind of
So yeah, high blood pressure, high cholesterol, diabetes, obesity, lack of physical activity. There are other things like, in terms of the choices that we make very explicitly about drinking alcohol or smoking, those are also risk factors. The lack of education or less education, that's also correlated with increased risk of dementia.
I got like 13 out of 14 here.
Depression is another one that's interestingly correlated as well. Hearing loss, vision loss have now been incorporated among these risk factors, these modifiable risk factors. Air pollution is one that's kind of distinct in that, we don't really make a choice about air pollution. That's kind of around us. We can petition our governments to do better so that we don't have the kind of exposure that we might otherwise have. But that one we have a little bit less choice in. Traumatic brain injury is also another risk factor, and the lack of social activity. So we saw over the pandemic that people really had increased rates of or accelerated kind of diagnoses of dementia or dementia-like symptoms presenting, right? Even if they didn't have a full diagnosis of dementia, and worsening of people who already had that diagnosis. Yeah, so there are lots of things that we can do, and you're not going to even get that message, quite honestly, from someone, again, who doesn't speak your language, who doesn't know how to navigate in your culture, right? There are different cultural norms for how people engage within families, right? In different cultures, and not being a part of those cultures, not understanding those cultures. How are you as a clinician then going to be able to navigate that? It's challenging. And so I think it makes it a lot more difficult also for then people who don't have a lot of representation, right? People as patients and their families who don't have a lot of representation, i.e., a lot of their own backgrounds reflected in the people who care for them as healthcare professionals. It's harder then for them to actually get the appropriate counsel, right? Not just diagnosis, but once they have a diagnosis, to get the appropriate counsel and care, right? So yeah.
You mentioned TBI or traumatic brain injury, and Obviously I teach a CEU class about it, but there's the what you call this traumatic encephalopathy for football players, CTE, chronic traumatic encephalopathy for soldiers and football players, ladies and gentlemen. And these are young individuals, healthy, they're like working out all the time, but they have that CTE, the brain injury, and they get early onset dementia, ladies and gentlemen. Imagine that. They're even padded. They already got those fancy helmets and everything, but they're having CTE, chronic traumatic encephalopathy, and they're having, memory issues, behavioral issues, just because of that. Like what I said, they are even protected. They have those fancy helmets. These are, young NFL players, and they're having behaviors. What more for an actual TBI, where there's no protection? You hit your skull, your head you fell or something like that. And it's very important that you also get that checked out, concussion uh, therapy or assessment. So again, we talked about diagnosis, risk factors, modifiable, non-modifiable. Dr. Donna, how about a solution? How can we find a solution? Do you have any resources that we can go to again?
Yeah, I mean, in terms of culturally fluent resources, as I've mentioned before, there just are not many, or in many cases, any. So, this is why we do the work that we do at Prognosis. It's really to be able to reach the people who are disproportionately impacted in terms of the incidence of Alzheimer's disease and related dementias, or related disorders. It is helpful to actually have a resource like the one that we've created, which is actually rooted in story. It's in the stories of the caregivers who are caring for people with dementia, and these are diverse caregivers, right? So you're seeing your own experience reflected in the stories of these caregivers, and there, our library of stories. It's kind of a learning library, right? For what we call situated learning, right? We learn best when it is relatable, what we're hearing, right? And so these are stories of people who look like me and you. They talk about Alzheimer's disease. There are also other dementias that are related in our story library. So Lewy body dementia, frontotemporal dementia, vascular dementia are also represented there. That's not all of the dementias. There are less common dementias. So end-stage Parkinson's disease can also have dementia that is associated. There are other dementias as well. Normal pressure hydrocephalus causes a kind of dementia that's actually reversible. And there are also rapidly progressive dementias. There are many different kinds of dementias, but we won't go into all of those in that story library. We really focus on the top 4 most common. And as I said before, Alzheimer's, this is World Alzheimer's Month, is the most common. And so you'll see a lot of that represented there. There is a lot of mixing between Alzheimer's and vascular dementia, which actually is called a mixed dementia. And it is those 2 dementias that can sometimes be seen together. And we also talk a bit about that there through these caregiver stories. And so this makes it super relatable. It's also in the languages of the people who are hopefully coming to the site and listening to these stories, right? So they're available in English, Korean, Spanish, and simplified in traditional Chinese right now. Those are written stories in Chinese at this moment, but everything else is also available in audio stories.
We got videos on that website?
There are no videos. We have actually the pictures of the storytellers who are real caregivers. Many of them are friends of mine or family. And yeah, there aren't videos though. We actually intentionally made it that way because we know that caregivers are very busy and often trying to do multiple things at once. And so we made the audio available for them to kind of listen to the stories in kind of a Spotify playlist. Yeah, you can imagine that.
Wow.
Yeah.
Well, again, thank you very much, Dr. Donna. Appreciate you. Before I let you go, again, is there any website that they go to? Like what you said, prognosis.com or something?
Yes, exactly. It's prognosus.com. Yeah. And I think I had mentioned before that the other The other resource that I have seen do a decent job in terms of cultural fluency is the Family Caregiver Alliance, which is cacaregivers.org, or caregiver.org also will go there. But that's a really great resource that is also multi-language. Yeah.
You know what? I used to be part of that, and until someone bought it.
Oh, really?
Yeah, I used to. I can't remember if I was like doing blogs or whatever when it was still owned by the previous. I don't know if it was bought out or somebody bought it or took over. But
Hmm.
yeah, because it was just plain caregiver.com website only before. Now it was like it's a fancy website now that has I can't even understand, navigate it because it's so what you call this? It's so diverse now. You see, I'm looking at their website now. It even has our language translation. You got the Chinese, Vietnamese, Spanish, and
Right.
of course Tagalog, where what I speak. So it's amazing how it transformed because before it was just like regular website. So yeah.
Right. Right. Yeah, no, and we try to keep things very simple on our
Mhm.
website as well. Like, I think there's even a lot less than this to navigate through just because we know that the audience of people coming to it, some people are actually impacted by the cognitive symptoms themselves.
Mhm.
And others maybe like their contemporaries, right? So, like spouses of older caregivers who might not be as digitally fluent. It's helpful. Again, it's kind of like cultural fluency, right? It's really trying to meet people where they are. So we are trying to do that also in how we present the materials that we offer for our family caregivers.
Amazing, amazing. Again, thank you very much, Dr. Dar. Appreciate you. Anything else that you want to add before I let you go?
I think that's it. Those are the big things that I wanted to cover. I just wanted to remind everyone that it is World Alzheimer's Month, and to be mindful that as healthcare professionals, and that we are often dealing with families who may have very different backgrounds, that would certainly inform how they kind of take in this diagnosis and how they navigate this disease, and to be sensitive to that. I think, probably the easiest things to do, because we can't educate ourselves about everything in advance necessarily, is to just ask, right? To just ask the family, how are you thinking about this disease, right?
Mm,
How can I best support you? What are some of your concerns? I think approaching it with that kind of curiosity and humility will really go a long way.
that's so true. So true. Sometimes we forget to ask for help. Asking for help is not. So we want to act like super caregivers, but caregiving is not taking care of yourself and asking for help is not selfish. Okay, so do the ask method. ASK. Ask and you shall receive. Seek and you shall find. And knock, they'll be open to you. And again, thank you very much, Dr. Don. I appreciate you. Be awesome. Be great. Be excellent. And we'll see you in the next episode of our prognosis show. Thank you, Dr. Don.
Thank you so much.